Hi, good day, everyone. My name is Christine. We are Group 7. Our team members are Amandeep, Esther, Ango, Christine, Karuna, and Sunetra. And our topic is about Imogene King. We will be discussing the introduction of the theory and theories, major concept of the theory, fundamentals ideas about the theory, how does this theory or philosophy relate to the 21st century nursing practice, case scenario, client assessment, client goals, nursing interventions, rationale using theory, and client evaluation. Imogen King was born on January 30, 1923 in West Point, Iowa. She received her nursing diploma from St. John's Hospital School of Nursing in St. Louis, Missouri in 1945. In 1948, she earned her Bachelor of Science in Nursing from St. Louis University and went on to complete her Master of Science in Nursing, also from St. Louis University in 1957. Imogen King was a pioneer of nursing theory development and member of famous scientists list. The name of the theory is Interacting System Framework and Theory of Good Attainment. It develops in early 1960s and the model focuses on the attainment of certain life goals. According to Good, the major concepts of theory are health. Health is defined as dynamic life experiences of human being, which implies continuous adjustment to stressors in the internal and external environment through optimum use of one's resources to achieve maximum potential for daily living. Nursing. Nursing is defined as a process of action, reaction, and interaction whereby nurse and client share information about their perceptions in the nursing situation. Self. The self is a composite of thoughts and feelings which constitute a person's awareness of his individual existence, his conception of who and what he is. A person's self is the sum of all he can all call his. The self includes, among other things, a system of ideas, attitudes, values, and commitments. Nursing theory in 2020, personal system like individuals, perception, growth and development, self, body image, space, and time. Interpersonal systems like groups, interactions, communication, transaction, role, and stress. Social system like society, organization, authority, power, status, and decision making. According to Good, 2014, mutual goal setting between a nurse and a client is based on nurse's assessment of clients' concerns, problems, disturbances in health, nurses and clients' perceptions of the interference, and their sharing of informations, whereby each function to help the client attain the goals identified. In addition, nurses interact with family members when clients cannot verbally participate in the goal setting.
Hello everyone, I'm Karuna. I'm continuing the major concept of the theory. Emoji King tested her theory by conducting research that described the process of goal attainment is achieved through the nurse-patient interaction. This illustrates how the process of human interaction lead to transaction. The next one is fundamental ideas about theory assumption. According to the early good in the nursing is an observable behavior found in the healthcare system in society. The goal of nursing is to help individuals maintain their health so they can function in their roles. Nursing is an interpersonal process of action, reaction, interaction, and transaction. Perception of a nurse and a patient's influence the interpersonal process. And in the portions, The individuals are spiritual beings. Individuals have the ability through their language and other symbols to record their history and preserve their culture. Individuals are unique and holistic and intrinsic worth and capable of rational thinking and decision making in most situations. Individuals differ in their needs, wants, and goals. And for in the health. Health imply continued adjustment to stress in the internal environment through the optimal use of one's resources to achieve the maximum potential for daily living for environment. And understanding of the way that the human being interacts with their environment to maintain health was essential for nurses. Furthermore, adjustment to life and the health are influenced by an individual's interactions with environment. The next one is this theory or philosophy related to 21st century nursing practice because it guides nurse to recognize that the patient is at the center focus and by supporting and facilitating patients in maintaining and caring for themselves. Next one is the nurse function is to interpret information in the nursing process, plan, implement, and evaluate nursing care. The next one is the three interacting system describe to nurses the wholeness of the individual, which is personal, interaction between individual which is interpersonal, and the influence that social system having governing behavior and interaction which is social. In the our case scenario, Mr. Yam is a 43 years old male admitted with lung cancer. Mr. Yam is married and has two children. He recently lost his job and now his wife is a primary breadwinner. Mr. Yam was admitted 2 days ago and has been diagnosed with stressor lung cancer. He has trouble breathing. He's always out of breath whenever he's talking or mobilizing. He has a cough with a little bit blood and complain of chest pain. He rates his pain at about 4 in 10. He also has a history of COPD and MRI indicated that Mr. Young has stage 3 lung cancer and it hasn't spread to other distant organ. The treatment plan for Mr. Young is for him to undergo surgery in the next few days and chemotherapy will follow shortly after that. And the Mr. has a lot of weight over the past few weeks. He said that weight 73 kg about a month ago, and his weight at admission was 65 kg. Mr. has been smoking since he was 16 years old and has tried to stop smoking on multiple occasions with no success. Mr. mentioned to the nurse that he would like to quit smoking. He also mentioned to the nurse that he regrets smoking most of his life and now he worries so much about his family and how they are coping with him being sick and losing his job. He also feared that he does not have much time left. Thank you.
Hi, I'm Amandeep, and I'm gonna start with client assessment. Patient is having a trouble. Mr. M is having a trouble breathing, and he's out of breath when he's mobilizing. And he had a cough with a little bit blood. He had a complaint of chest pain, and he scored his pain uh, out of 10 4. He had lost some weight, about 8 kilograms in over a month. Mr. M smokes and shares he would like to quit smoking. He expressed his feeling with the nurse about how his family is coping with his current illness and unemployment status. And he also expressed his fear on future. He is uncertain and that he don't have much time left. Client goals demonstrate understanding of disease process by compiling with treatment regimen and identify significant signs and symptoms. Minimize the symptoms such as dyspnea, hemoptysis, chest pain, and weight loss. Identify the reason behind not able to quit smoking, help him to quit that, and understand prescribed medication regimen through compliance. Mr. M and family will exhibit empathy and provide a supportive environment to assist one another in making role changes. Have adequate support in place, make decisions regarding care, effectively cope with identified lifestyle changes, express feelings of uncertainty about his future. Nursing considerations. Assess the patient level of understanding regarding disease and treatment condition and tell about his risk factors, disease process, complications, usual treatment and treatment options. Teach teach about his prescribed medication regimen, their action, what are their side effects, symptoms, and require physician attention. Encourage Mr. M to express his emotions, feeling with others, show empathy, and support to him. Assess Mr. M mental and emotional status, for example, signs of denial, depression, non-compliance, dependency, and set limits with maladaptive coping mechanism and provide positive support for effective coping. Identify level of stress and follow appropriate actions such as relaxation technique and medication. To relieve signs and symptoms of dyspnea, teach Mr. M about deep breathing and coughing exercise and pursued lip breathing to promote relaxation. Mr. M also advised to take breaks in between activities. Hemoptysis. Inform the doctor about the amount and color of blood and follow doctor's instruction. Chest pain. Identify the level of pain and the pain provide the pain medication. Weight loss. Take into consideration to treat any post-operative symptoms such as nausea, vomiting to maintain healthy appetite. Refer to dietitian for assessment and advice and plan for caloric intake and improvement of health. Discuss with Mr. M and team members of the possibility need of the internal and paternal nutritional support for quitting smoking. Assess what he did in the past and steps that he took. Reassure Mr. M that he is on the right path for wanting to quit smoking. Provide smoking suggestion counseling. Provide options for Mr. M and how to quit smoking, such as nicotine gum, nicotine inhaler, or nicotine patch. Assist him to explore a new way to accomplish goals with exhibiting limitations and refer to a counseling, psychiatric, and social worker as needed.
Hello, everyone. My name is Esther, and I'll continue with rationale for interventions about Mr. M's specific needs. To explain the rationale for interventions about specific needs with the theory of goal attainment, we will first consider the nurse and patient's perception, judgment, and action. This should lead us to a reaction, interaction, and transaction. For the nurse, perception. The nurse recognizes that Mr. M is fearful and unsure about his future. The nurse also identifies that Mr. M has concerns about his family, how they're coping with his illness, and the current situation of him losing his job. Judgment. Mr. M will need professional help from a psychiatrist to help him cope with the recent changes in his life, that is the current state of his health, and losing his job. Action. Provide support and refer to psychiatrists for counseling and social worker for support to support them in their needs. For patients, perception. Mr. M regrets smoking most of his life and is now fearful and unsure about his future. Judgment. Mr. M may feel hurt because the nurse is actively listening to his concerns, worries, and fears, and therefore builds trust. Action. Mr. M and family are cooperative in the care and willingly accept the referrals for counseling through psychiatrists, support from nurse and social worker, and counseling for smoking cessation. Mr. Nurse patient's reaction. Nurse and patient communicate effectively, set goals, and mutually agree on the activities that will help achieve those goals and healing. Interaction. Mr. M communicates his needs by telling the nurse about his fears for himself, worries about his family, and his willingness to quit smoking. Transaction. The nurse establishes the expectations that will help Mr. M deal and cope with his current health status to support a healthy healing condition. Mr. M and family are willing to work with psychiatrist, social worker, and being educated about smoking cessation to attain coping strategies that will aid in a positive outcome. I'll continue with rationale using theory. Main intervention. Mr. M has stage 3 cancer. Due to his health condition, he lost his job. He also fears that he doesn't have much time to live.
The nurse can intervene to provide health education and health promotion to give the prescribed medicine. Nurse-client relationship, therapeutic communication, and perception. According to the King theory, appropriate nurse-client relationships, mutual understanding among nurse and clients, the goals and function of nurse and the patient need to be in line with each other, as well as knowledge of the nurse to establish a relationship and set up the goals to attain goals. Therapeutic communication is the key to nurse-client relationships. It helps to get help from the patient to provide patient-centered care. The nurse should understand the patient's values, beliefs, needs, and goals because each person is unique. As a whole, persons interact with the environment. The personal system is included dimensions of perception, development, body image, personal space, learning, and coping. The nurse should understand Mr. M's perception. Perception significantly contributes to nurse-patient relationships. Thank you.
Hi everyone, I am Sunitra. I will continue final part of the presentation. Better interaction and accurate understanding about patient's personal system to attain goals. The patient thinks about his family. He suffers from his lost job. He has fear about his health condition and he feels that he has to leave in a short period. He has feeling of despair over the future. He may not be satisfied with the medical report or the treatment. Sometimes he may doesn't like to stay in hospital. He may feel about his past life and he may angry about himself. When treatment and nursing care are delayed, patient may be bothering and exhausting. The nurse need to have an accurate understanding of patient's perception and image. If the nurse doesn't understand the patient's personal system well, it negatively affects for nurse-client relationship. An accurate understanding of between nurse and patient helps to achieve the goals. Understanding the patient interpersonal system and plan the care plan. Based on King's theory, the interpersonal system is created by person interactions. Nurse and patient interactions are most important for communicate with the patient and accurately understanding each other. The goal of the nurse is to provide patient-centered care. If the nurse knows the patient's needs and choices, it helps to make a proper care plan. Therefore, the nurse should understand the patient's real situation and should identify his real needs. The nurse should respect his choice, values, and beliefs. Identify the patient's social system and help him to fulfill further requirements for maximum patient outcome and patient's future well-being. He lost his job and social contacts. He has economic problems. He suffers a lot from his health condition. He thinks about his life. The patient needs new social contacts to start a new life in the present situation. The nurse should be responsible to provide psychosocial support and welfare support. The nurse can coordinate with counselor and social worker to provide support to the patient. If there is a cancer society or any other support organization, nurse can provide information to the patient and his family members. He smoked in his past life. He can share his experience with smokers and can join the non-smoking social team and he can work with them. He can engage to religious activities. The nurse can provide all information about relevant services to the patient to further requirements, and all these help to develop the patient's future well-being. Finally, client evaluation. The client evaluation by using King's theory applied in client's assessment, planning, implementation, as well as evaluation. Nurse did assessment on Mr. M to set mutual goals and at the end all goals is achieved and decrease the symptoms such as dyspnea, hemoptysis, chest pain, and weight loss. Patient got a better knowledge about his disease condition and treatment, progressing day by day to quitting the smoking. Patient and their family physical and mental condition is improved. Anyone need to follow further information, references are here. Thank you.